Hello, everyone. Welcome to the Western Pacific and Oceania regional webinar. I am Keiko Nakamura from Planetary Health Alliance Japan Hub, as well as Planetary Health Alliance East Asian Hub. I am the co-chair of this regional webinar, and I am very pleased to work with excellent speakers today. And then I wish we have a good interaction with a large audience today. We have, for the first 45 minutes, we have the plenary session, and then 5 speakers today. I'd like to introduce the first speaker, so Dr. Megumi Teshima, the second Vice President of International Council of Nurses. She will speak on the video to you.
Dear colleagues, dear students, I am Megumi Yamaura-Teshima, second Vice President of the International Council of Nurses. It is a great honor to speak with you today about the issue that is shaping the future of our profession, our health system, and our world. The role of nurses in planetary health and the leadership of the ICN in this essential work. As this slide shows, the World Health Organization estimates more than 30 million deaths each year are linked to avoidable environmental causes. Nurses are the world's largest health profession. We are trusted. We are present in every community, and we understood better than anyone how environment conditions shape health. Because of this, nurses are essential leaders in planetary health. Nursing values and ethics already align our profession with the protection of the environment. The ICN Code of Ethics for nurses state clearly that nurses must preserve, sustain, and protect the natural environment and aware of health consequences of environmental degradation. It also calls on nurses to advocate for initiatives that reduce environmentally harmful practices and promote health and well-being. At the COP30 in Brazil in November last year, ICN made the nursing voice heard loud and clear. ICN's leadership was also recognized by WHO in its COP30 report, wherein highlighted that nurses are at the forefront responding to climate-related health threats and acknowledges nursing ICN vital work on promoting sustainability, disaster preparedness, and climate-resilient health systems. ICN leadership extends beyond climate change to other major environmental health threats. Last year, as negotiations advanced on global treaty to end plastic pollution, ICN joined the Healthcare Without Harm and other major health organizations to demonstrate strong commitment to reduce plastic use and protect people from plastic-related harms. ICN has been clear the health sector must lead by example, not be exempt from sustainability requirements. We must redesign and detoxify essential medical plastic, eliminate unnecessary use, and ensure transparency about chemical ingredients. This is essential for patient safety, environmental protection, and global health equity. In 2025, ICN released a new topic belief titled Nursing for Planetary Health and Well-Being, emphasizing the vital role nurses play in addressing the health impact of our shared environment crisis. Our topic brief highlights the planetary health education. The framework has 5 foundation domains of planetary health knowledge, values, and practice. Together, these 5 domains help students and professionals see health issues from a planetary perspective and work across disciplines to create solutions. Colleagues, that the health of our planet and health of our patients are inseparable. Protecting one means protecting the other. Together, we can shape healthier, more just, and more sustainable future for all life on Earth. I hope that many of you can join us for the 31st ICN Congress in Taipei next year to continue the discussion. Thank you.
So thank you, Dr. Teshima, Megumi Teshima, to giving us overview of ICN's the wide approach for the planetary health. Now we have the broad view of how our International Council of Nurses are doing. And then on that platform, today we'd like to hear and then discuss regional signs of climate change and environment disruptions from four speakers. First, I'd like to introduce Dr. Yukari Nakano, Executive Director of Japan Nursing Association, the leading association of nursing and midwife in Japan and the region. So, Dr. Nakano, you have the floor.
Thank you, Dr. Nakamura. I tried to share my materials.
Receive them. Go ahead.
Yeah. My name is Yukari Nakano from the Japanese Nursing Association. I'm truly grateful and honored to have the opportunity to speak here today. As you all know, today planetary health has become an important global health issue. Firstly, climate change and environment degradation are increasingly affecting population health. At the same time, it is also well known that the healthcare systems designed to protect people's health are themselves having a negative impact on the environment. In this context, there is an expectation that nurses, as the largest professional group in the healthcare sector, will play a crucial role in supporting a sustainable and resilient healthcare system. That's exactly why we are holding this meeting today. Many international organizations have highlighted the growing impact of climate change on health. For example, United Nations report states that climate change is one of the greatest health threats facing humanity and is already harming people's health. And the World Economic Forum estimates that climate change will cause an additional 14.5 million deaths worldwide by 2050. Consequently, the health of the planet has become a top priority worldwide. So, in this context, is public understanding growing? According to a public opinion survey conducted by the Cabinet Office, more than 90% of Japanese people are interested in this issue. Furthermore, in the corporate sector, major companies are leading the way in transitioning to renewable energy, adopting science-based targets, and disclosing information. On the other hand, according to a survey conducted by the Health and Global Policy Institute in 2024, while 70% of the respondents stated that the climate change is an important issue for nursing professionals, only 40% were aware of the relationship between climate change and health. And only 20% knew the status of GHG emissions from the healthcare sector. So suggesting a need for more information and education. Today, I have been asked to speak on the topic of hospital and outpatient settings. Here's one important fact. The healthcare sector accounts for approximately 4 to 5% of global GHG emissions. In other words, healthcare is both a victim and a contributor. These emissions can be classified into 3 categories based on their sources, as you know. And it is also said that the practice of single-use items in medical institutions adapted for the safety of patients and healthcare workers contribute to the increase in emissions. Given this situation, the Japan Medical Association has set a target of reducing emissions by 46% by 2030 compared to 2013 in its action plan. However, this is not an easy task at present. Under these challenging circumstances, I think nursing professionals are expected to play a significant role. This is because nurses are working on the front lines of hospitals and outpatient settings, and are also responsible for a wide range of duties, from direct patient care to indirect administrative tasks. This means that nurses are in a position to directly contribute to reducing emissions from healthcare facilities through their daily practice. So what should we focus on right now? Firstly, nurses could contribute to reducing DHG emissions from healthcare facilities. This includes reviewing the supply used in daily practice to reduce unnecessary consumption, as well as reviewing and streamlining practice to ensure that they are appropriate and efficient. These efforts not only reduce the direct impact of healthcare facilities, but can also influence the supply chain. In this context, I believe one of the advantages of nursing professionals is our ability to address the trade-off between infection control and reduce environmental impact. Secondly, while healthcare demand is expected to increase due to an aging population, it is also crucial to influence the future healthcare needs of individual patients visiting hospitals and outpatients. Preventing prolonged treatment periods and readmissions leads to a reduction in emissions from healthcare facilities. Finally, healthcare can have a positive impact on society by addressing climate change strategies with patients and encouraging behavior change for planetary health. I'm sorry, I skipped this slide. And finally, let's take a look at the Western Pacific and Oceania region. This region is characterized by the presence of many island nations, and there are disparities in income levels. In addition, climate change-related disasters are already occurring frequently. Healthcare systems vary widely across countries in this region, and healthcare demand is changing rapidly due to demographic shifts. Additionally, the region's vulnerability to climate change due to its geographical and topographical characteristics has been highlighted. Therefore, from a policy perspective, it is crucial for healthcare systems to be resilient to climate change and sustainable in the face of shifting demand. In particular, although there are differences in the maturity of healthcare systems, I believe that precisely because of this, there could be crossover between the measures taken by different countries from the perspective of planetary health. Therefore, to ensure the region's sustainability amid advancing climate change, it is essential that we learn from each other and collaborate closely. That is precisely why we continue working on this issue and discussing it with all of you. Thank you for your attention, and I hope to see you at the 3B3 session again. Thank you.
Thank you, Dr. Nakano. Oh, yes, and for so raising awareness of among nurses for the planetary health issues, and then so because of that, and so I think, and so this webinar itself provide very important learning opportunities, and then sharing the challenges and characteristic of diversity and changing of the issue in the region, and then we look forward to discuss further how we will counteract to this situation. Next speaker for today is Dr. Hyeonkyeong Lee from Yonsei University, the Republic of Korea. So, Dr. Lee, you have the floor.
Yeah, hello everyone. I'm Hyeonkyeong from Yonsei University College of Nursing. It is my pleasure to meet with all of you. I'd like to briefly share my experience in the area of planetary health research and education, rather than explaining all picture of the Korean status. Among the points shown here. Let me. Okay, here. The last one, educational integration, has not yet been fully examined with the unlocked evidence. So at this stage, I can only note the planetary health is being partially addressed within community health nursing curriculum. For the remaining areas, I will briefly speak based on my experience, based on my institution. The topics I will cover include institutional foundation, conceptual expansion and nursing, the emerging research focus, scholarly discourse and exchange, and student engagement. First, I would like to begin by highlighting the Institute for Planetary Health at the institutional level at my university, Yonsei. The Planetary Health Research Institute was founded in January 2025 at Yonsei University. It is the first institute of its kind in Korea dedicated to planetary health. Its mission is to become the global leader in addressing the health challenges facing humanity and to advance planetary health equity. The institute brings together a strong global network of over 53 researchers, including collaborators from organizations such as the WHO, Harvard, and Hopkins, along with multiple domestic and international partners through the former collaborators. Our center, named the Center for Planetary Health and Nursing, I'm in charge, is one of 27 centers within the Planetary Health Research Institute. And to our knowledge, this is the first center in Korea within the field of nursing to focus specifically on planetary health. As a brand new center, we are guided by our vision, nursing for people, nursing for the planet. Based on this vision, we are committed to educating and developing nursing professionals in planetary health, conducting research that advances planetary health and health equity, and expanding nursing practice and social contributions for sustainable health. Through these objectives, we aim to contribute to advancement of nursing and to play a meaningful role in promoting a healthier and more sustainable future. Let me talk about the conceptual expansion in nursing. Dr. Jacqueline Fawcett proposed the expansion of a nursing meta-paradigm reflect a shift toward a more global and system-oriented perspective. Traditionally, the meta-paradigm has been grounded in 4 core concepts: human beings, health, the environment, and nursing. However, in response to contemporary global challenges, these concepts are being reconceptualized. In particular, the concept of health is extended to planetary health, and the environment is reframed as a global environment. This expansion aims to encompass the interconnected effect of climate change and other planetary health drivers on the well-being of both human populations and Earth's ecosystem. Actually, in my doctoral level course on the development of nursing knowledge I'm teaching, students engage in critical discussion about this evolution of the meta-paradigm. Through this process, students come to understand that nursing knowledge must move beyond traditional boundaries and incorporate a broader, integrated perspective that addresses the dynamic relationship between human health and planetary systems. This is regarding research issues. This is one of the school's key research priority areas, and planetary health-related topics have been identified as an important domain within nursing research. It is expected that more researchers will increasingly make effort to connect their work within the field of planetary health. In Korea, I can see some evidence on scholarly discourse and exchange already. In a leading nursing journal in Korea, climate change has been addressed in editorial. In addition, at the annual conference of the Korean chapter of the Sigma Society, we will also discuss directions for research and education from the planetary health perspective and share practical examples of related research and education initiative. And the organization, Korean Academy of Environmental Health and Nursing, was established in 2021 to address emerging environmental health challenges, including climate change, air and water pollution, and waste management, and chemical exposure that threaten human health. Regarding student engagement, in my school, our first step has been to explore the existing body of knowledge in planetary health. Our undergraduate and graduate students have taken the lead in initiating a seminar series, which we have named Deep Dive. We conducted 4 seminars focused on the building foundational knowledge by reading and discussing key essential papers in planetary health, including ICN statement. It was very encouraging to see that students showed a strong commitment and a high sense of responsibility through the process. Through this seminar, the students were able to identify the 3 key insights. First, the concept of health in nursing has expanded to include planetary health, definitely. Recognizing that human well-being is deeply interconnected with the Earth's natural system and influenced by global environmental change, Second, a transdisciplinary approach is essential, requiring collaboration across the science, policy, and practice to address the complex and interconnected challenges of planetary health. Third, action is critical, including integrating planetary health into education, advancing interdisciplinary research, and promoting sustainable healthcare practices to drive meaningful change. Looking ahead, we plan to continue advancing our work in several key directions. We will strengthen interdisciplinary and global collaboration, including engagement with initiatives such as the Global Consortium on Climate and Health Education at Columbia University. We will also continue to host regular deep dive seminars to sustain learning and dialogue. In addition, we aim to build a strong partnership with external institutions and actively promote collaborative research. Through this effort, we hope to contribute to meaningful progress in planetary health within nursing. Thank you for giving us the opportunity to share our school's effort from Korea. I hope that this virtual conference will serve as a starting point for building stronger connections and collaborating among us. Thank you.
Thank you, Dr. Lee. So thank you for sharing a lot of progress for research and research work, as well as an education with various forms to the students and then others. So this will be the good sharing with other participants in the region and beyond. Thank you so much. Next speaker is Dr. Erwin William Leyva from the College of Nursing and University of Philippines, Manila. Dr. Erwin, you have the floor.
Thank you, Nakamura, Dr. Nakamura, for that introduction. And thank you for the invitation to talk about climate change and environmental disruptions, of which I'm going to present a nursing perspective from the Philippines. First and foremost, I would like to declare no conflict of interest, and that the views expressed in this presentation do not necessarily represent those of the speaker's current or past affiliations or any of the organizations mentioned. And other than discussing climate change and environmental disruptions, we'd like to derive insights from the role of nurses in addressing planetary health teaching, research, clinical public health practice. And so just to share a little bit more about climate change in the Philippines, we know that the temperature has increased by 0.68 degrees centigrade over the past 65 years, and the annual and seasonal rainfall is increasing in most parts of the country, while it is decreasing in other parts of the country, in particular those affected by drought due to the El Niño phenomenon. The tropical cyclones are slightly decreasing in frequency, of which we have around 20 per year. However, the intensity of these cyclones are increasing. Furthermore, the sea level has risen by 5.7 to 7 millimeters per year over certain parts of the Philippines. So it's not unusual that the Philippines ranked first among 193 countries in the 2024 World Risk Index report for disaster risk. And so how are these environmental changes felt by the public? So it's not unusual, again, to hear in the news of certain places experiencing strongest landfalling tropical cyclone on record or the entire history. And in some places where we record new all-time hottest temperature in the given day. And so in the past, classes are usually suspended due to typhoons in the Philippines, but now it includes suspension due to extreme heat. And these are very concrete examples of how global warming has affected the communities. For scarcity, it was reported that around 40 million Filipinos still rely on unsafe, a significant need to address this water air pollution. It is noted WHO air quality guideline value for particulate matter, and that this has contributed significantly to a lot of illnesses. In terms of waste, there are studies that say that the Philippine rivers are the top plastic emitting rivers in the world, and that is primarily due to the use of single-use plastics. And if you can see on the figure at the on the right side of the screen, the waste have been increasing over the years. So it might be essential also to understand where are the greenhouse gas emissions coming from for proper interventions. And just like perhaps similar to some other low and middle income countries, that the top contributor is the energy sector with 36%, and the agricultural sector contributing 20%, while waste contributes 10%. So what are the roles of nurses amid these planetary health issues? Dr. Nakano alluded to this in terms of nurses being closest to the patients, wherein we would like to promote planetary health literacy and enable not just our patients, but us health workers to understand the state of Earth's natural systems and its interactions with human health as well as human activities. That we have to continue to raise awareness about planetary health among nurses, especially in the Philippines, where the conversation about planetary health priority, especially nursing and nurse migration. Global organization, Philippine Nurses Association, based in the Philippines, the Association of Deans of the different colleges of nursing, and the Commission of Filipino Overseas. And the topics in that conference dealt with the changing climate and environment, climate smart health systems from the perspectives of international policy and the World Health Organization, science-based solutions for climate resilience communities, and nursing commitment and engagement in climate follow through after in 2020, wherein we action for climate-friendly healthcare, the global green and healthy hospitals framework, and again, Filipino nurses committing to climate action. So pandemic, but nonetheless, we had certain activities also to promote research on planetary health. And it was interesting that Dr. Lee mentioned about the expansion of the meta paradigm. But nonetheless, we did the 30th National Nursing Research Conference organized by the Global Society of Philippine Nurse Researchers and the Asian Hospital and Medical Center, again, with the goal of increasing the interest of nurses to conduct planetary health-related research. There were also talks about the integration of planetary health into the Bachelor of Science nursing curriculum, and that is despite the observations that the curriculum is saturated already with other content relevant to nursing, and that many faculty continue to require training in planetary health. And so, and because we are a disaster-prone country, it is not unusual that the low-hanging fruits would involve preparing our communities for extreme weather events, and this is something that we involve our students as early as in the bachelor's program. So thank you very much, and I look forward to further discussions.
Thank you very much, Dr. Leyva. So thank you for listing all the environment challenges we are facing. And then also thank you for sharing a lot of actions has already started in the Philippines, both in the awareness raising among the nurses and midwives and education at school. And then to make the changes in hospital care. So thank you so much. Well, so this is regional webinar, one of 6 among 6 regions of this special conference. And then this Western Pacific and Oceania region, this is the most diverse region. And then so we need a creative thinking by learning from the lot of action already taken. Then also we will try to understand diverse issues and challenging in different environments. So therefore, there are a lot of learning from this regional webinar. Yes, and so then thank you very much. And then from and then so I think Dr. Teddy Potter, thank you for the comments on the chat. And then so as Dr. Teddy Potter already mentioned, in this region in Japan, Tokyo, the Planetary Health and conference will be next year, and then so the nursing and midwives and practices will be shared with larger planetary health communities, and then so we can continue information sharing and learning each other. So from now on, we will have 4 concurrent sessions, and then 4 sessions go through simultaneously. Participants, and you will choose one of those 4 sessions, but so don't worry, you can later view the video or recorded one after today's meeting, but please choose one of them. And then so that's 3B1. This is the topic Indigenous Perspective and Practices. 3B2. This is Community and Public Health Practices. This will be moderated by Dr. Kumiko Igarashi from Japan. 3BC, this is for hospital and outpatient practices. So the Dr. Yukari Nakano will moderate this session. The 4th session, 3B4, this is nursing education and research, where Dr. Hyeonkyeong will moderate the session. There's a very rich contents on all of those sessions, but please enjoy, and then also to enjoy interaction with speakers and moderator of respective sessions. And I'd like to ask all of you to come back to the plenary session again after the concurrent session, 1 hour session ends. Everyone will come back to the plenary and then to have the final information exchange, and then to discuss together what will be our next step. So please enjoy your concurrent sessions, and thank you very much. And thank you for the speaker today, Dr. Megumi Teshima, Dr. Yukari Nakano, Dr. Hyeonkyeong Lee, and Dr. Erwin Leyva. This the first plenary session to start this diverse learning in the Western Pacific and Oceania regions. Thank you for joining, and then see you later again.